Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Family, work, school, you've got a lot going on. I'm Aisha Roscoe from NPR. We know you're busy, so we've made staying informed easy. The Boise State Public Radio mobile app is a hassle-free way to keep up with the latest news and stories. Whether you're cooking dinner, folding laundry, or just tackling your daily to-do list, staying in the know has never been so simple. Download the free Boise State Public Radio app today, so even when you're busy, you'll never miss a beat. And join me for Weekend Edition every Sunday morning from 6 to 10 on Boise State Public Radio News.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. It's been 6 years since the start of the COVID-19 pandemic, and the virus that causes COVID continues to evolve and spread. In fact, scientists are keeping a close eye on a new variant of the disease that's beginning to spread in the United States, including right here in Idaho. It's Wednesday, which means Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us to talk more. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. In fact, we have quite a few listener questions to get to today. But before we do that, Dr. Pate, I want to start by talking about this new variant. What do you know about it so far, and why are scientists paying attention to it?
So what we know so far is that this virus continues to mutate, and it is trying to find better and more effective ways to infect people. And so it gets to try this all out in people that it does infect. And what's most worrisome is those people who are immunocompromised, who get infected, but may not be able to clear this virus. So now the virus can keep experimenting in a person and keep on responding to whatever immune challenges it does get from this immunocompromised person. That's how we got Omicron back in December of 2001, when we got our hospitals overwhelmed, because by the time it emerged back in the population, it had 30 some changes in it. This variant has 70 to 75 changes. So quite a few, but fortunately it hasn't yet, and I hope it doesn't ever, find the exact recipe to be able to do what Omicron did. So while this has a lot of mutations, it reminds us that that virus is continuing to mutate, and therefore we need to continue to evolve our vaccines for it. This one is on the rise here in the United States, but fortunately, it's not causing more severe disease.
Okay, so you mentioned the mutations, upwards of 70 to 75 mutations, and you mentioned Omicron, which we saw back in 2021. So here's what some scientists are saying, though, is that these mutations could evade some of the immunity that people have built up over the last 6 years, whether it's through a vaccine, whether it's through, having gotten COVID. So Dr. Pate, how concerned should folks be about that aspect of this latest variant?
Yeah, well, we should always be concerned, because it means that whatever protection you have, it is less effective as the virus evolves. And so everyone is theoretically going to be more susceptible to infection. However, it hasn't evolved so much that it is changing the fact that the vaccines do prevent severe disease. So for this particular instance, we're most concerned about the elderly and those that are very young who haven't seen this virus yet. So, young children and the elderly, as well as anybody who has serious underlying medical conditions, people that are immunocompromised. And what it means is that those of us that are older or those of us that are young would certainly benefit to keep up with the boosters and new vaccines when they're issued.
So, Dr. Pate, this new variant has been detected in 32 countries so far. It's also been detected in 25 states in the US, including here in Idaho. Do we have any information about how widespread it is in Idaho?
I don't have specific information about that, but there is no question that it is spreading within the United States and certainly has been across the world. The first detection of this particular variant was in June of last year when someone traveled to San Francisco from the Netherlands. And we know that this virus has been there and it's causing about 30 some percent of the infections in the Netherlands. But that person came here since June. It has spread, and you mentioned it spread to 25 states. And the first state that it showed up in is Rhode Island. So I think that was probably a second introduction into our country rather than necessarily that person from the Netherlands in San Francisco. But since then, we have now started detecting it in patients since the end of December. And we have detected it in 3 patients in 3 different states. And so it's clear that it's spreading. I don't think that this is necessarily going to lead to the kinds of surges that we saw early in the pandemic. But what this should be a reminder is while we are coming to a close of the respiratory virus season, and so we are seeing levels of influenza and other viruses generally on the decline. Remember that COVID doesn't follow that, and that we not infrequently see increases in the summer months. And so it could mean that we're going to be dealing with this this summer. I would not be surprised at all.
So, Dr. Pate, the CDC is also reporting that this new variant is showing up in about 11% of wastewater samples nationally. How useful is wastewater surveillance at this point when it comes to detecting COVID? Because my understanding is of a lot of counties and cities don't necessarily look at that to the extent that they did when we were in the midst of the pandemic.
Well, yeah. And so certainly if you don't look at the data or test, you're not going to find it. However, for those sites that are doing testing, and we still have data from West Boise, for example. So I commend people for continuing that testing. It is actually very helpful because in most all of these cases, of course, other than that initial traveler, we detected it in our wastewater in those states before patients became ill with it. So it has turned out that for COVID, wastewater testing is very, very helpful. It's also interesting that we did detect it on wastewater testing of airplanes. Because a lot of the introduction of these cases into the United States and then the spread is coming from travelers, as it appears to likely have happened in this case.
Okay, so you mentioned, at least at this point, Dr. Pate, that we're not seeing it being as severe, right? So it's no more severe, this variant, than we've seen in the past. Hospitalizations aren't necessarily happening to a huge extent. That's what health experts are saying, at least for right now. But what does that tell you? Like, how do you take that information?
Yeah, I take it as that, first of all, it's obviously good. I don't want to see people hospitalized. I don't want to see people dying from this. No doubt people will, but it's not causing alarm in that respect. However, it goes back to what you and I were talking about just a few minutes ago. And the fact that here we are, more than 6 years into this
Hmm.
pandemic, and because we did not do what was needed to control the spread of this virus and to protect immunocompromised people from the outset, here we are 6 years now. We're talking about new variants with 70 to 75 mutations from the last strain. What that tells me is this virus is not out of options yet, and it's continuing to test new options to see if it can get around us. And if people become complacent and we continue to get lots of people infected, then we do run the risk that this virus is going to finally hit the jackpot, where the numbers come up if you play it long enough, and it could, instead of just having this immune evasion effect, it could be more what we call virulent, cause more severe disease. Fortunately, why this particular strain doesn't appear to be more virulent is that it swapped in those changes. Sometimes viruses swap one thing for another, and what this one swapped was the ability to bind to that ACE2 receptor, the way it gets into our bodies. It sacrificed some there to get around the immune system, and that's not the best recipe for a virus if it intends to really destabilize us, like happened back in 21 with Omicron.
Okay, so let's talk about vaccines now, because James sent us in a question, and what he wanted to know is this: if you received a COVID vaccine last fall, do you need a new COVID vaccine um, coming up in the fall? And is there going to be a COVID vaccine this year? So, Dr. Pate, let's first take that first part of the question. Okay, um, are we covered by this new variant if we've had a vaccine in the last year?
Well, it depends on what you mean by covered. So,
Okay.
if by that you mean that you can't get infected, no, you're not covered that way. The vaccines, contrary to a lot of the disinformation out there, they do have some effect on decreasing your chances of getting infected. But it typically is soon after getting the vaccine, and it quickly drops off. So that's not the main advantage. The main advantage to the vaccine is preventing you from getting serious disease, ending up in the hospital, and or dying. And so although it's been shown to benefit every single age group, obviously the ones that will see the most benefit are those that are most likely to end up in the hospital or die, because that's where you see the greatest decrease. And so that's going to be very young children, and it's going to be those of us 65 and older, or adults that have underlying medical conditions or immunocompromised. So yes, and the problem is that the immunity is not so long lasting that, like many other vaccines, you can get one and be done, or get a booster in 10 years. So those that are at risk and want to reduce that risk, the best advice is to get every updated COVID vaccine, because that is to account for changes in the virus like we've just seen. And then for those that are particularly at risk, like I'm planning to get mine in the next couple of weeks here, is to get the mid-year booster, even if it's the same, which it is, the same vaccine that we had that I think I got in either late September or early October last year, and probably most of the listeners did.
Okay, so let's take the next part of that question then. Are we going to have access to a COVID vaccine in the fall?
That is a much more difficult question. If you had asked me any year prior to this, I would have said absolutely. But I tell you, I have no idea what's going on with this. Well, I have some ideas, but nothing I can talk about on the radio here. But I don't know what they're planning to do. I think that they will have an updated vaccine because, frankly, with a mid-year election, it's not going to do well for them if there are a lot of seniors dying or young children or getting sick. So I think they will, but I'm going to have to watch it to make sure. Hopefully they will. I think they will.
So, Dr. Pate, Denise sent this question in literally as we were talking about this new COVID variant. So, Denise is 69 years old. She's been keeping up with her COVID vaccines on a regular basis. She just got a note from her pharmacy saying she's eligible for another booster right now. So, here's her question. She wants to know if she should get it now or if she should wait because she has a multi-trip coming up around mid-September. She says she has always followed the CDC's advice, but right now she is wary to follow that advice. So basically, what should she do, Dr. Pate?
Well, I empathize because I'm wary of their advice as well. Here's what I would say. First of all, if your trip was sooner, I would be trying to time that booster to your trip. The problem is that we may not see the fall booster widely available by then. I hope so. But I think that the best thing to do under that circumstance is go ahead and get your mid-year booster right now. First of all, you're eligible because you're 69. Second, by getting it right now, technically, you will be eligible for a shot this fall. And if we talk sooner to that, we can time that vaccine to your trip. So I would go ahead and get your booster now. And one of the reasons is that we have seen in people that keep up with these boosters and keep getting those shots, they get a better antibody response and a broader one, meaning that it'll be more effective against various variants. So I would go ahead and get it now, and then let's talk when we see what happens. And the reason that I'm hedging about this fall is that technically it needs the ACIP, the Advisory Committee for Vaccines for CDC, is supposed to approve the shot so that it is covered and so forth. And the ACIP is in complete pause mode because of a lawsuit. So I don't really know what's happening there. I have to think it is going to get straightened out by then. But let's go ahead and get your booster right now.
Okay, so Dr. Pate, we've got quite a few questions actually coming in about these booster shots. And so in case we haven't, you didn't cover it all with that answer, I do want to read Ray's question and Nancy, because Ray said he recently received a message from his pharmacy, again, getting that second dose of a COVID vaccine to protect him from serious illness. And he goes, I'm an old guy with health issues. Is this good prevention for a person like me? And then Nancy, she also said, for those of us who are over 65 or immunocompromised, should we be getting that booster shot for COVID right now?
So for Ray, as a fellow old guy to old guy, yes. I'm getting mine in the next 2 weeks. And so I would suggest that you do the same. And Ray, the reason is that especially us being old guys, but you mentioned that you have some health issues. So we both are at increased risk, but you're even more increased risk because you are mentioning to me that you have these underlying health problems. And you really are not going to have the full effect still lasting from your last vaccine. So that's why I do want you to go ahead and get your booster now. Then to Nancy, and Nancy, exactly correct. Because of your age, you mentioned something about immunocompromising conditions. Yes, very important for people in our age group. And for those, especially who are immunocompromised, but we are to some degree immunocompromised by our age. Our immune systems just don't work as strong. So we need those boosters. So, yes, get your booster now. And then for Ray and Nancy, listen to the show. When we get to this fall, I'll know better about what the new vaccine is going to be, what it will cover, what the options are, and at least I hopefully will. And then I can make a recommendation about getting your fall vaccine so that we can protect you for the upcoming holidays.
Okay, Dr. Pate, I'm going to throw in a question of my own. I have a kiddo going off to college in the fall. I am assuming that I'm going to say make him because I'm going to make him, that he should also, right? If kids are going off to college and if you've been getting your kids these COVID vaccines, I would say think strongly about doing that before they head off to college. I mean, dorms seem to be disease ridden.
Well, I agree on both accounts that dorms are very germy places, and the other thing is when we get to college, we tend to not be able to keep our hands to ourselves, and so lots of disease spread around. But I also agree with the fact that you're probably going to make him, and he's going to be scared enough that he's going to do whatever you say. But yes, it's a good philosophy. Let's be clear here. If you listened to those who have been undermining our public health, what they would tell you is that kids don't need these COVID vaccines. Kids are just fine. Um, they are misrepresenting what the actual data is. And the actual data is that every age group benefits from, at a population level, from getting the COVID vaccines. Now, is there some less benefit for healthy kids? Yes, we see they don't typically get seriously ill. They don't typically die. But here's what we also know: there are kids out there that do get hospitalized and that do die. And we cannot always predict because sometimes it's a matter of how their immune system overreacts to it. So we don't really have a good test for that. And so, yeah, chances are kids are going to be fine, but every age benefits. Now, the other thing is that the strategy of those opposing vaccines has been to say that, look, the vaccines are dangerous, and that why would you give them to kids who aren't going to die? Well, first of all, I can't tell which kids are going to die or not, but I take their point. Most kids are not going to die, but that is to ignore all of the other potential complications of COVID. And it ignores long COVID, which does happen to children. We have proof that now. It ignores the potential that we are seeing some signals of for some long-term problems that are more likely to occur with every COVID infection that you have. And so even if it's a low risk, I've always wanted to protect my children. If my children get into a car and drive a short distance but without their seat belts, they are taking a risk that I don't want them to take. Are they going to probably be fine? Yes, but why take the risk? And so I think that obviously we need to be most getting the message out, particularly to the older population and the very young
Mhm.
population. That is the most important, but it's important for everyone.
So, moving on to some other questions from our listeners, Chris wrote in and he said, when the late President Jimmy Carter was treated for a brain tumor, did the doctors use gene therapy? And if that is a yes, could that treatment be banned in Idaho under new proposed laws?
Well, it's a great question. First of all, as far as the publicly available information, and it is fairly extensive, I think President Carter was fairly transparent. So I do believe I have all the information. I just can't be assured of it. I haven't looked at his medical records. But no, it does not appear that he had gene therapy. Now, but you're still asking a good question because I just answered the question as a physician. Now, if you ask our legislature that has decided all of a sudden that they're all doctors and don't need to talk to doctors and they know all about gene therapy, which they don't, who knows? Because they're considering things that we doctors do not consider to be gene therapy. However, even under the way the bill is written, I believe it would still be permissible, even if it was, because there is an exception for cancer treatment. But what President Carter received was actually what we call a checkpoint inhibitor, a monoclonal antibody, and so that would not be covered. When doctors are talking about gene therapy, we are talking about those conditions where we need to alter the genes and actually create a change in those genes. That is not what happens here. That is not what happens with mRNA vaccines. But it would be nice if our legislature figured out what it was.
So William wrote in, Dr. Pate, and he said he wanted to know about when we discussed the best diet for the brain, and then his question is this: is it that red meat? Is it inflammatory, or is it the chemicals added to the animal's feed? If that, I don't know, I may have botched that question.
Well, it's a good question, and let me explain what I understand of it, realizing that I'm not a nutritional expert. But how I would answer your question is it's the meat. So what we know about foods that create inflammation in our bodies, red meat is an offender because it is high in saturated fats. Additionally, and part of the reason it has that red look to it, that we call it red meat, is it has heme iron. And iron it can be a problem more so in men than women, because women tend to of middle age tend to lose iron because they menstruate, whereas men don't, and so men are more subject to overload and so forth. But there's also another chemical in meat. It's the red meat itself. It's in glycolyl neuramanic acid, and that isn't natural to humans. And therefore, when we ingest it, it is possible for our bodies to recognize it, that that's not us and we should probably attack it, which can contribute to inflammation. Uh, Finally, let me just mention a couple of things that further increase the risk. One is high temperature cooking, because if you're grilling or frying, I mean, I've never fried red meat, but there's probably people out there that do. I think people fry everything now these days. But if you're grilling or frying, that also causes some chemical changes that the byproducts are also inflammatory. And then the other thing is when you get processed meats, you get the deli meats and those kind of things, the additives and preservatives that are in those meats also tend to trigger inflammation. So you now have exhausted the entire knowledge of Dr. Pate on the subject.
Well, I think it's more knowledge than most of us have, Dr. Pate. So.
Well, I get humbled all the time.
Oh, well, don't we all? Well, Dr. Pate, as always, thank you for taking time for us today. We did not get to all of our listener questions, but do remember, please send them in. You can do that by sending us an email, idahomatters@boisestate.edu, and we will try to do our best to get to those questions next week. We've been talking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. And text this podcast to a friend. It's how podcasts grow.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.